Hello, and welcome to today's virtual program hosted by the Healthcare Council of Chicago. My name is Megan Phillip, and I am the Executive Director of HC3. We are a mission-driven platform proactively seeking uncommon alignment to improve Chicago's healthcare ecosystem. Today, I'm just thrilled to be hosting our second event of a series of around the role of women in healthcare. And we are just excited to be talking to several providers and their different perspectives and their journeys in their careers to advancing opportunities. So before we dive in, I have two housekeeping announcements. This afternoon's discussion will be recorded and shared on our website, www.hc3.health, for later viewing and sharing. And as we hear from today's experts, if you have any questions, you can view the chat function to add anything, and our moderator will see it. So now it is my absolute pleasure to invite our special guest to join us in the virtual room and hand it over to our moderator, Lori McGraw, who is a Senior Vice President at the American Medical Association and host of Inspiring Women with Lori McGraw podcast, where she interviews inspiring women in all stages of their careers to explore and share their professional journeys. Today's panelists are Dr. Bobby Byrne, Chief Information Officer, excuse me, at Advocate Aurora, Dr. Kathy Demu, Midwest Market Executive at Cigna, and Dr. Cheryl Rucker Whitaker, the Chief Executive Officer at Complete Care Management Partners. Thank you all so much for being here with us this morning. Lori will be the guide for the rest of the hour.
All right. Terrific, Megan. Thanks so much. And thanks so much to the Healthcare Council of Chicago for hosting this Women in Leadership series. This is the second in a multi-part series. We kicked off at JP Morgan earlier this year. I can't believe it's already February. And that we were speaking with a number of accomplished women innovators in venture and whatnot. And today we're speaking with three incredibly accomplished physician executives with tremendous careers, perspectives, and advice for all of us in terms of how to lead during this very active, confusing, complicated time. So Dr. Byrne, Dr. Demu, Dr. Rucker Whitaker, thank you so much for being here. I really appreciate sharing this hour with you. We've got a lot to cover, and we were talking a little bit before about what we wanted to dive into in this hour as amazing, accomplished healthcare leaders and physicians with background practicing. Dr. Demu still practicing today, caring for whether it's children at home or aging parents, as well as workforces that are in the tens of thousands, as well as people who are on the ground delivering care. We're going to go through a number of the challenges as well as opportunities during this time today, as well as we want to cover some of the, as women leaders, as accomplished executives, how did you get here? So to just kick off, to just break the ice here, I thought we'd just do a quick roundtable of, what was the first moment, or what was a moment where you realized you were on the path to leadership? So Bobby, I'm going to start with you.
Hi, good morning. Thank you so much. So it's interesting. I was a practicing pediatrician, working on some kind of early pay for performance, and realized that sort of everything was on paper, and we were sort of having trouble even getting this thing off the ground. And that's telling you just how old I am. But I started to realize that I would be in a room and I could understand everybody. Like I understood the IT people and the quality people and the practicing physicians, and then but there wasn't this point where they understood each other. And I realized like I didn't really understand. So like I seem to be the translator. And so I was the one who was kind of pulling these things together and saying, when she says this, she means X. And then when he says this, he means Y. And people be like, oh, that really helps. So I think that's kind of when I realized that there was something that maybe I was meant to do that was a little bit different than seeing kids every day, which is also work that I loved. But one thing else that's interesting is that I have learned just as much from leaders on what not to do as I sometimes have learned on what to do. So as I've gone through my career, I think about those, like think about the good ones, the ones who you're like, I want to be like that person, and the ones that are like, oh, I'm never going to do that. And I think that's really been helpful.
Well, that is great. And just by the way, a moment of truth. I mean, I've had the pleasure of working with Bobby in the Wayback Machine when we were in some of the early days of technology entering healthcare. Not to age myself. Kathy, what about you? Your first sort of like inspiring moment of that path to leadership?
Oh, absolutely. And again, thanks for inviting me to this great discussion. Happy to be here. So I think that going back from when I started medical school, I was unapologetically interested in volunteering for anything. But the moment that it really dawned on me that I might be getting somewhere, I might be actually on the leadership path, was when Dr. Cynthia Boyd, who was one of the physician leaders at Rush, where I was on staff, nominated me to be part of the executive committee of the medical staff. And so that taught me two things. It taught me that, people respected what I did. They thought that I got it, was able to, again, translate like Bobby did, but also the importance for me to kind of bring other women up and really engage them, make sure that they, knew what they could do, try and think, who else should be in the room? Who should we be talking to? Are there people of color? Are there women? Are there enough? Does this represent what society looks like? And that to me was really telling. And that was just a very seminal moment in my career.
Yeah, that's great. And I mean, I think it goes without saying as, as physicians, that in and of itself is, a path to leadership. But there's, even more that you have done beyond the important work of caregiving for patients. So thank you for sharing that, Kathy. Cheryl, what about you? That moment that might have been impactful to you and inspired you to be the leader that you are today?
Thanks, Lori. Thanks for having me today. I've been studying a student of health disparities, excuse me, my entire career. I started out doing research, and I thought I was going to be a great researcher, make full professor, write papers, travel, speak, lecture. And I was on my way to doing that as a young assistant professor. And I kept running into these really blatant disparities that seemed intransigent, and I couldn't understand it. I started studying the system, understanding, for example, Medicaid. And I learned that the state spends, at the time, it was 20 billion or more on Medicaid. And I was scratching my head and I go, well, how could we be spending 20 billion a year or more on Medicaid? And the communities that I'm engaging with, which were at the time were the South Side of Chicago, and then at one point the Lawndale community and around there on the west side of Chicago, had these horrible disparities. And I became a student of health policy and finance. I began to really understand, because where the money is spent, that's the system, right? And the way you spend money is it generates the results that you get. So was a big student, and then I picked the hardest thing possible that anyone could ever do. I said, you know what, if X, Y, or Z isn't going to fix it, I'm in. I'm going to jump in head first, and I started a managed Medicaid health plan. That is the hardest thing to do in the world, but we did it, and I got an amazing team that stick together, and we did it, and we were busy working hard in those communities. But at the core of it was really kind of understanding, wow, policy and finance, that's what drives where dollars are spent. Where dollars are spent drives the results that you get. That was a real pivotal moment for me. It happened back in, I'm going to say like 2010, 2011. And I've been hard at work ever since. So I call myself an accidental entrepreneur. So I really started as a scientist, sort of policy academician. I had an RWJ award. I had an NIH award, and I was on my way. But I pivoted quickly when I figured out, wait, I think I can make a bigger impact here.
Well, you're all making an incredible impact, and sort of like every step of the way just seems to be like the next, and the next. We're in now, unfortunately, the 2-year mark we just crossed of the pandemic, where the first COVID cases hit Chicago. You are all on the ground leaders. You're seeing the delivery care. You're providing the delivery of care. So I'd like to maybe hit some of the different angles of this. What are you seeing? and then in terms of your leadership through the course of the pandemic to its current state, and what you see in the future, just different aspects that might be important to share. So maybe Kathy, if you could just highlight what you are seeing. We'll start with you, things that you're focused on, and then from the point of view of leadership, what's been important to you and what you've drawn on in terms of your own strengths in that area.
Sure, absolutely. So I think the thing that really, and we had kind of a visioning session yesterday where we talked about how has the pandemic changed us and what actually motivates us and influences us during the pandemic. And I think the thing that I've noticed is just the impact of uncertainty, because it is tenuous out there. We think we're fine and then we're not. And I work in value-based care. I work with providers, with hospitals and physicians, trying to bring more value and improve quality to healthcare and to reward people for that. And it's hard when things are uncertain. But I think looking at our outcomes, especially as a nation, we have the highest mortality rate of any nation in the world, and we can do better. And I think that's kind of what brings us together. So it's really motivating people, not saying, well, we're not sure how things are going to turn out, so we shouldn't do anything. It's really trying to, let's work together. Let's trust each other. Let's really try and move forward and improve quality and outcomes, because we can do it. We're very smart. We can figure out how to move forward and make things better. Because I think if the pandemic has taught us anything, it's taught us to sit back and look and see what the impact we've seen. To Cheryl's point, the impact of disparities, the impact of having kind of a fragmented healthcare system, and how can we make that better? Because we have to. It gives us the opportunity to reimagine healthcare in general. So that's kind of what motivates me. That's what excites me about my job, and what really helps me work with my colleagues across the Midwest to improve value-based care.
How's it changed for you, Kathy, just in terms of sort of like where we are now in the pandemic? Certainly there was nothing but uncertainty 2 years ago, but just in terms of how are you leading through? Are you changing your approach? Are you at Cigna? What can you be a little more what you're doing?
So I remember early on talking to my boss when this hit, and I said, as we're trying to measure people, we're going to see tremendous variations in data, and you can't measure people when you're seeing that variation. So what we did was we went back and kind of reimagined our value-based program. We came up with something called COVID Care, where we looked at kind of maintaining care coordination, funding that, having an emphasis on quality, on bringing people in to complete those gaps in care, and not necessarily focusing on finances, because we couldn't. And so we had to go back and talk to all of our, partners and say, listen, this isn't going to work. We need to figure out how to reimagine this. Can we change for a year or two? So now we're starting to move back, where we're looking more at finances and how we can look at cost of care. But we really wanted to step back and say, we need to focus on quality. We need to focus on making sure that people get the care they need. And we need to make sure that, when healthcare was in disarray, that people could really make sure that you had that outreach, that nurse available to call someone, bring them in. You haven't been in for breast cancer screening. What can we do to make sure that happens? So that's really what we focused on.
Great. Cheryl, what's your perspective? And I think Kathy mentioned some of the disparities. I mean, there's been a lot of attention on that, certainly, but what are you seeing, and what do you think can be done about it? And then as a leader, what have you brought to the conversation that's been particularly impactful?
Yeah, so I have the angle of working really close to the ground with members and impacted communities, which means I have to have a workforce that is willing and is competent to work with those communities that we're talking about. So one of my biggest challenges was making the decision to go to a fully vaccinated workforce. I had the experience pre-vaccine to have, and I was in a slightly different role at the time. I saw most of my company get sick, which meant we lost days and days and days of productivity of work. If people weren't sick, they were going to funerals. Okay, because remember, in the work I'm doing, I'm heavily focused on the south side of Chicago and the west side of Chicago. We do statewide work, but we have a predominance in some of the highly impacted COVID zip codes. And so a lot of my people were out the last half of 2020. People were out, you know, and I've got the data because I can show you how much bereavement leave we granted. I mean, we were very, very generous. People were off, they weren't working. So when we found a vaccine, the vaccine went live and it was clear after, thousands and then millions of people received it that it was safe and also had impact, I made the decision to go to 100% vaccinated workforce for a few reasons. One, to keep the members of my company safe because they're in the communities that are impacted, which means if they go out and they're not vaccinated, they could pick COVID up and bring it home, et cetera, and I'm down a person in my work. And that person is not calling and checking up on the members and communities that we're taking care of. So I think it's been a very challenging time because 80% of my employees are African-American. And in the communities where we're working, we have the lowest rate of vaccination in the city. So you can imagine that, wow, I'm saying, well, I need to have a vaccinated workforce because I need them to be able to speak to my community about the importance of the vaccine. So I think a big leadership opportunity and kind of a pivot was that making that decision and moving forward with it. Now we supplemented that with almost monthly updates on where we are with COVID. I have a great senior medical director who was great at distilling the data, and we would make, hey, this is what they're saying. Hey, this is the recommendation. We're going to go with this. This is why. And people are still finding that extremely helpful. So we did that all during the pandemic. And, you would think, well, yeah, I could take that and do it for all the South Side, but I really want to focus on this group of care managers, social workers, nurses, LPNs, registered nurses, et cetera, who are right in the throes of care management, because this is really their community too. And so to the extent we can bring them along with, hey, these are what the facts are, I think that benefited not only my company, but the community at large. So I think it's been a challenging time to move towards vaccination. You've seen all of the different national rhetoric. The Supreme Court did this, they didn't do this. For healthcare facilities, they said, okay, you can mandate it. And so we're in that group, but it's not clear, how this all going to play out. But I think, we can't lead in an environment where, we have to let sort of data and facts drive our work and what we do and the decisions that we make. And then we have to be courageous and do that. So I'm really excited about that. And what I'm hopeful of is that we went 100% vaccinated. And again, we're a small company, so we're 40 people. We're not, both of your Kathy and Bobby, your companies are huge. And as a matter of fact, one of the people that we termed, one of his comments was, well, Advocate and U of C are giving exemptions. Why can't you do it? Well, they have 30,000 employees. They've got a fair amount of redundancy here. I have no redundancy. And if we go down, that means I'm not getting care to a member. So it's been a very challenging space to be in. But I like the idea of sticking to the facts. And then I think as medical professionals, we really want to work hard to distill those facts down in whatever platform we're in to try to get this to where we're talking about facts and keep the level of hysteria and drama and mistrust down. So it's been, I think, a challenging time for leaders, but an opportunity to lean in.
When you made that decision, Cheryl, for the fully vaccinated workforce, that sounds like you made that pretty early on. I'm imagining, was that a popular decision? Was that an unpopular decision? It was clearly, you're clear it was the right decision for your organization. But how early on did you make that?
Well, it's been, relatively recent. We were in September. We announced it, I believe, in the summer, midsummer, August, maybe. And we gave people until, I believe, the end of October. So we gave folks a lot of time, but remember, along the way, we've been talking about it and giving people facts and saying, hey, leading them, this is the best decision. And then we started, and then the next step was, we're going to be a CDC recommendation shop. This is who this company is. And so if you want to work here, this is what we're going to do. And then we went live with the mandate. Like I said, we're very small, so we're only 40 people, But for the work we do, it just made all the difference in the world but we walked people to it. So we didn't just say a mandate. No, we spent a lot of time talking about the science, educating on vaccines. I mean, we probably over the course of the year did at least 12 convenings on it as a company.
Well, part of leadership, as you all know, is, in decision making, knowing that when you know that something is not going to be 100% positive, which is almost every decision, is what is the communication that goes alongside it, but also being grounded, as you are, Cheryl, in this is why the decision's being made. This is, we're going to stick with it, and then providing the information, knowing how it may or may not land with the people who are receiving it. So thanks for sharing that. Bobby, you are a Chief Information Officer of one of the top 10 largest integrated healthcare systems that are out there delivering care in over 500 physical locations. So you're seeing your fair share of complexity in terms of care delivery, where we are with COVID, what are you doing?
Yeah.
And then a little bit about how you are leading during this time. It'd be awesome to hear from you.
Yes. So COVID, like I think we should talk about COVID as like COVID years are like dog years, because in 2 years, I think we've lived at least 7 years for each year. And when you think of, I think for everybody, and certainly for provider organizations, COVID is not one thing. COVID 2 years ago is very different than COVID today. So we went from how do you find PPE? How do you set up surge units, to all the way to how do we figure out how to get, video conferencing set up, very then quickly into how do you do vaccines when vaccines are scarce. And now you're trying to use health equity in order to make sure we get those early vaccines to the first people, to almost on a dime, flipping from we have scarcity and vaccine hunters to now we are trying to convince people to get vaccines. So those are two very different programs. Almost then right into the next surge, and now right into a staffing issue, right into a whole, the Great Resignation and everything that's going on there. And so I'm trying to think about what is it that we've learned within these years, because this thing isn't over yet. We're going to have more learnings, but what is it that we've learned within this time that we can then normalize? And because people are craving some sort of new normal, this is the way we do things. So I think everybody thinks about video visits and the success of video visits and how we, accelerated that part of care in a really quick manner, even though those numbers have come down into, they're not 50% of visits like they were at one point, but they're coming down to a point and people are understanding this is a really excellent way to deliver care. How do we, but even more than that, what are the data and analytics structures that we put in, right? We started to push data out to our leaders on a daily basis. And guess what? Once they're used to getting that, now they say, hey, can I get this on a daily basis? Can I get that on a daily basis, right? So how do we increase our data and analytic structures? How do we use that health equity learning that we use to target those vaccines in those early days? How do we use that? For us, we're now really focused on blood pressure, uncontrolled blood pressure, and on increasing the vaginal delivery rate, which is obviously super important for moms and babies. But how do we use those learnings to kind of pivot forward? How do we use the workforce flexibility? We sent everybody home. Well, heavens, if you're sitting in a suburb of Chicago or of Milwaukee, you probably can be sitting in Georgia. Maybe that's where your family is. Maybe that, is better for you to be working remotely from another state. So we're trying to get our arms around that. I personally worry a little bit on the remote workforce, and especially how this is going to impact women. We love the flexibility, and our parents, men and women with kids, little kids at home, love that they can have that flexibility for those who can work from home. I just hope it doesn't turn into women are not going to have the promotion opportunities because they're the ones who are, staying at home and doing the Zoom school as we continue, because I think that would be a real, we've had so many positive benefits of this. For those who can do this, I would hate to see that we, that we have a negative impact on women being able to be promoted. But that's my focus is now around, I don't want to talk specifically about COVID anymore. Let's talk about what we learned from COVID and how we can make that, a better, stronger, faster, organization. And of course, I say that right until the next surge happens, where then we start, running around and setting up surge beds and tents and all of those other things happen.
Do you feel that, and I'm curious, just, are we out of the crisis management and now into I'll just call normal high level of management, or is it a day by day for each of you?
If
You know,
we're crisising anywhere, it's on staffing, not specifically just COVID, but just the implications of COVID. I'm sorry, Cheryl, I didn't mean to.
No, I
Are you-
want to, I'm in a 100% agreement, Bobby. I just wanted to piggyback on what you were saying about, I mean, now people want the data all the time, right? So I think one of the things that, when you say, Lori, what state are we in? I think one of the good things that happens was the amount of time we spent on our informatics build, and our ability to kind of get the data down to what a person actually needs to see when we create kind of day-to-day dashboards to be able to measure productivity. When people are 100% remote, we're not in an office. My team is subject to going out in the field, so we're not in the office. We're field-based is a better term. But I think we built a lot of the infrastructure in, I hope, for communicating or managing data and getting it out to folks, and also for kind of managing what people are doing on a day-to-day basis. So I think part of leadership is to take deep breaths and stay calm. So I don't want to say we're in a crisis anymore, because that, I think, is, everybody's blood pressure was up, our cortisol was up. And like Bobby says, we've all aged 7 years. I'm looking at, even my own, the circles under my eyes. It's like, where did all that come from? It is the last 2 years. If I do it before and after, we can all see it. So I think, from a leadership mindset, no, we're not in crisis. We are now managing a new normal. We spent the last 2 years building out capabilities, infrastructure on the informatics side, the IT side, the IT security side, and as well as, hopefully being able to better manage kind of remote or field-based productivity. But I do agree that, as we move forward and we want to grow our businesses, if we need more staffing, I do think that, to me, feels like the biggest liability, but risk, if you will, or dependency, if you will. But for me, that's also building a vaccinated workforce, because I do believe that that's a really important. If you're in healthcare, we need to be vaccinated, because we hold up the whole system. And if we go down, then the system goes down. So we're not 100% reliant on, we can't just run a telehealth, right? You can't do everything with telehealth. Some things you need a person to do, and you need staffing and capable and competent staff to do that.
So if we're not in crisis management, which is great, and we're using data and infrastructure and things that have been built across the past 2 years to sort of lead for the next, I'm curious also, just, as leaders, during this time, how are you keeping the energy up, the focus? I think that, there's Bobby, you mentioned the sort of, a lot of the staffing changes, great resignation, great reevaluation and reset. There's many different terms what people are thinking about. But how are people keeping their energy up? I mean, that, people look to you for the cues in terms of how to lead, where to go. Kathy, how are you keeping your energy up? Is your energy high now? Are you refreshed in the new year, or are you feeling exhausted? I think, there's a lot of variety in terms of how people are doing it during this time.
I think a lot of my day depends on how well my 6-year-old sleeps, but beyond that, I think it's important, to be that light, to have clear goals, to reinforce that we can do this, to be the cheerleader, and also to be flexible. I mean, I think this is what we learned throughout the pandemic, is that nothing is the same as it used to be, and that's okay. And I think it's doing a lot of listening, really touching base with your staff. We haven't had as many issues with staffing because, we did have more flexible work capabilities, because we do, have a lot of work from home and have, that as a mindset, as a kind of a national company where we're not necessarily, or at least my staff isn't kind of in direct patient care, but really more of a support. But we have learned that, people do get burned out. People do have, issues at home. I think one of the interesting things that Cigna did early on was they gave everyone 10 days of emergency time off. And I remember being surprised in a positive way, because that was the right thing to do. So if you had COVID, you had extra time and you didn't have to, come in when you might be sick. If you had childcare issues because you were running Zoom school, and you could take time off for that if you needed to get your vaccine. So it teaches us to really be to listen to people and really come up with solutions that are simple, but really are what people need at that time to really help support them and to really make them feel to feel loved, to feel cared for, to say that we get it. We know that this is a different time, and maybe we should have been listening more to people, previously, but this is what we need to do to make sure that people, can go to work, can be happy, and can do that. And we've seen the impact of mental health, throughout the nation, and we'll continue to see it. I think it may get worse over time as people are trying to kind of get back to that new normal. But it's just about listening and about being there for your employees.
How are you doing though? How are you sort of keeping your energy up? 6-year-old at home. I'm exhausted just hearing it.
Yeah, no, I think it's what struck me with the pandemic is how much it had affected all of us. And we had one family member, was a great aunt in the UK, die of COVID, but I lost a lot of friends to cancer. And so it really taught me to be very thankful for what I have, and to also realize how lucky I am to be able to work, to be able to spend more time with my child. The last 2 years have been incredibly challenging, but I'm also very thankful for what that is. So that has really helped motivate me and really make me think, what's important to me? What do I need to do with my family? What do I need to do with myself? I need to take better care of myself and make sure I get that. What I really dedicated myself was getting more sleep over the last, so I've added like an hour of sleep over the last 2 years, which is incredibly important. So, and how do you maintain that going back into the workplace? So that's really how I motivate myself and try to.
That is actually great if you can find that hour of sleep and just those reflections of very difficult circumstances, and then the ability to have empathy because of that. Is incredible. Cheryl, you mentioned that at the beginning of COVID with your team, lots of funerals and things like that. I mean, that is overwhelming. It just seems quite overwhelming, and needing to be the leader during that time. So how just, in the challenge of that, how have you been able to keep your own energy up and the balance that you need to lead the way you do?
Well, I want to admit that I nearly got to burnout before I realized, and this was right around the holidays. Okay, so I didn't do a great job of it. But some new things that we started in Q4, we're intentionally doing kind of 3-day weeks, 3-day weekend every month at the company, which just lightens people's loads in terms of thinking about their paid time off and everything. We're sort of saying, hey, we're gonna release you. We're doing 4-day work weeks for folks to the extent that we can, at the company, because we have a call center and we're in the streets, so we have to balance everything. But I also hired people who want to work every other Saturday or every Saturday. So instead of stretching staff to work, because we want to cover Saturdays for the work we do. So we've just been, to Kathy's point, and I think Bobby talked about flexibility. But I've also been flexible, with my executive team. There's 4 leaders that run the company. No meetings on Friday. It doesn't mean we don't work on Friday. It just means no meetings, no Zoom presence required, but you can kind of catch up to yourself and get situated. So I've been using that to sort of slow myself down and give myself a little more time. The other thing I found, and again, you would think during COVID, you have a little more time. I found myself busier, to be honest, but I wasn't working out, and I was working out before. I'm like, wait, this doesn't make any sense. So got my workouts going again. And then during COVID, I find myself having a glass of wine like every day. Well, I didn't do that before COVID. So now I'm just like, okay, I'm just going to just go cold turkey for a while. I think I just need to sort of clear my system. So I mentally and physically kind of made some changes to kind of get better balance. Then the other thing I'm doing with my team and with myself, when I say I'm taking vacation, I don't now do not check my email. I put my work phone down.
Wow.
And it's very, very difficult to do. But I have someone who covers it, and their job is to cover my email. But I do think it's really important in an environment where we can be on Zoom for hours at a time to unplug our brains and our minds and allow ourselves some space. I mean, that's a real thing. And I'm leading with myself on that. My daughter has ADHD, and going to Zoom school, she was at one point, she just hit a wall and said, Mom, I can't do another class on Zoom because my focus doesn't allow me to really do well in that environment. And so that's when it really hit me. Wow, everyone isn't equipped for this. It's not the best for everyone. So we also, look to lighten that load in many ways, as I described to you guys about Friday meetings and trying to release sort of on-camera time. But it's been a journey, Lori. It wasn't sort of instant that I wish I'd taken care of myself all through starting 2 years ago.
Yeah.
But better late than never. Like Bobby said, these have been dog years. And I do think we want to be very careful that we're not living in a hypercortisol state for, anymore. Like, we've got to bring the cortisol, the stress levels down, and kind of move forward and create a normal that's healthy for us and our families too.
Yeah, leadership, during this time of COVID, particularly in all of your positions, it's an endurance sport. We didn't necessarily know that it was going to be a couple dog years of endurance, but recognizing those things. And I think it's, thank you for sharing that, leaders like yourself, recognizing even you too, can become to that level of burnout. Bobby, any tips from you in terms of how you recognize yourself how to recharge?
Yeah, I reinforce everything that my colleagues have said. I have this kind of crazy British mother. She's 96 and she's relatively proper, and she'll say, Barbara, if that job puts you into an early grave, they'll just get somebody else to do it. And so that voice is sort of in my head from time to time, and she says it not infrequently. And so there are all this back to the basics. Get the workout in, step away from the desk, all of those kinds of things. But I want to add one thing, is that everybody needs to have like their peeps that they can vent to, because it is very important that the 1,600 people who are on my team, they don't need to see me when I am not at my best, right? Mm-hmm. Because they need to see me as the one who's saying, let's get back to basics. It's about the patient. We can do it. We do hard things here. Look at what we've done. I mean, they need me to be an honest, authentic cheerleader. And so I see this sometimes with leaders where they're very stressed, and then they think that like they can just vent to the whole world. Like, no. It doesn't work that way. And the higher you go, the more you have to be very careful about what persona you show, especially to those people who don't know you very well. They're not your best friends. But for sure, I have the people who I can just like get on and then like put my head down and like, oh my God, I can't believe this happened. And but just keep it a little bit segmented, I think.
Great point, Bobby. Great point.
Yeah. Let's talk about the, we mentioned the workforce issues and remote work while, being tired on Zoom. Let's talk about, what this means for women. We know that just, from the statistics, from the studies, women are carrying more than their fair share of the workload, whether it's caring for children, whether it's caring for parents, and that doesn't by any means mean that they're carrying all the load. However, it's more than their fair share. Women in leadership, you all had opportunities, you are accomplished, you know what it took to get there. So just Bobby, maybe some thoughts from you in terms of just practical strategies for just, there are definite issues, but what should women be doing? What might be some practical advice for women who want to advance and not get lost, left behind, as you see it?
I think women need to be more overt about it. And I think that goes against our tendency. So, I'll say, I'll kind of like toss a ball to a man. For the most part, they're like halfway down the field before that. Whereas with women, I have to kind of like push them, a little bit, like a little more, and have to be, have to do things differently. And if I think about equity and how we are trying to inform equity, it involves that too, knowing that different people need different things from their leader or from their manager. And so women might need slightly different coaching, guidance, right? You may need to give them a whole lot more permission and then say, hey, come back to me only when this has happened. Then you might need to with a man. Now, mostly people are people. And so you know, you're going to have to treat people differently because they need different things. But I think just keeping in mind that it's not women's tendencies to take over. It's not women's tendencies to be boastful. So sometimes you have to be boastful for them. Hey, Susan came up with a great idea and we're going to go do this. And, or, you know, like I still love, you know, on Obama's cabinet where the women made a point of reinforcing the other women's comments just so that they would be heard. I think those are some really just basics, you know, it's nothing,
They
I don't
are
have any secret sauce,
basic,
but
but
it's basics.
I think these are strategies that are important, and they were important before the pandemic, but now there are these new issues. So I think that is great. And then, you know, maybe Kathy, what about at Cigna? Are there strategies in particular that you're leading with to help women, or do you have thoughts specifically for women as individuals in terms of what they should be doing?
Sure, we have a lot of formal structure. So we have a women's resource group, and I think, and I'm a part of that. I think that's important. In the Midwest, you know, we also talk about, you know, how to lead by example, how to engender mentorship. And I have been in a formal mentoring program, which has been invaluable, and got there because of a peer who in another market had a good experience. So I try and talk about the importance of mentorship, both formal and informal. And so I think that's important. And then I think just leading by example, talking through kind of what things I do to strategize and, you know, and how to kind of get through the day, because women are used to kind of taking everything on and hugging it close and not wanting to give that up. And so, you know, I try and be very thoughtful. Like my daughter was very vocal and would break into meetings all the time, and I would make it natural, because I think it's important to kind of like not shoo her away, but say, oh, and this is Sarah, she's learning at home today, and have that be part of the meeting and not be embarrassed by it. And so the people felt comfortable, because you need to kind of bring it down to everyone's level so that they do have a feeling of comfort. But also talking about how, you know, working with my husband, how we can manage things at home, because it is harder. You do have to structure things. You have that, you know, executive exhaustion where you're trying to remember everyone's schedule and just really talking through things as a family. And we'll talk a little bit about how we do that in everyday life, to give people some hints on the best ways to move that forward, because not everyone has, you know, people that they can rely on. And so is there a way of making things easier? I talk about Instacarting all the time. I did it pre-pandemic. I, you know, will do it. I will pay anyone anything to take things off of my plate and make my life easier. And I'm lucky because I can do that, but, you know, maybe there are other ways, you know, my colleagues can, you know, get some help. So that's what we've done.
Yeah, there's a
Can I
lot of
just jump in on that real quickly, just because it's so, my kids are in their 20s, I have 3 kids, and I think it's like starts with the person in the mirror, because before the pandemic, I was always embracing flexibility and work from home and that kind of thing. But, you know, when like a child would interrupt a meeting, I would be like, you need to get childcare, right? When you're working, because there's work time and then there's home time. And I think I was really I think I was like more rigid than I should have been. And now with the pandemic, I'm like, oh my gosh, now I just have an appreciation for how people are really just doing the best that they can. And so I admit that I needed to change in order to make it work for, you know, for everybody and for the department. And now I'm in a totally different place. So sorry to jump in, but it's like, it's like my catharsis admitting my faults, you know.
Oh, no, great.
confessions.
Yeah, because it's changed. It wasn't normal 20 years ago to, you know, bring kids to a meeting. But I remember when it happened once, and I felt bad for the woman who did it, but you have to support them. And I wish I had been more vocal at the time. So we're all learning.
And that shows a lot of empathetic leadership, which is tremendous. But I think we also need to recognize that, you know, you as empathetic leaders, that is not everywhere. And so how are you thinking about how women can make sure that they're not held back? If they have an empathetic leader, that's wonderful. If not, then what? I'm Cheryl, just, we know the barriers are there. So just,
Right.
advice would be great.
Well, a few things, so even though we're in sort of a hybrid world now, because I'm doing some meetings in person. I, travel up to Silicon Valley every month. We meet in person there, which is really, really fun. I figured out I was really craving that. So I'm excited about that. And we do some local meetings here in Chicago also. But there's a few things. One, executive coaching is good for young managers or directors who need to learn to find their voice and have some support to do that and figure out how they insert themselves in a room. You know, before, and so two, there are meetings, but that means before the meeting is important. So, if in this new hybrid world, you want to make extra efforts to get to know colleagues who are part of this decision-making hierarchy at your organization. I think what they used to call it water cooler time. And so we have less of that now. So you're going to have to be intentional about, hey, can we grab a quick 15 minutes Zoom? I just wanted to, hey, ask you a question about X, right? Like create a reason to interact with people so that when your voice is in the room, that they're like, oh yeah, I talked with her about X. She's pretty knowledgeable about this. Let me listen to her now and not restate her suggestion as my own, which does still happen to women, unfortunately. So I think that's important. The other thing I think in terms of, how we move forward, I was thinking about this, when we went sort of 2 years ago to virtual, pretty much everything, you were falling back on your existing networks. And so in terms of your career advancement, it was, okay, your network was your network, right? Because that's what you had to fall back on. So, you could say we lost maybe some strides in terms of what normal networking opportunities would be. And by the way, I hate the word networking because I hate to feel like I'm being networked, but relationships or people relationships, I like to say, are very important. And, seeking out opportunities to still nurture and grow relationships with people is important. So you have to be now more intentional. If there's an opportunity to go to something, you should probably go to it, mask up, follow the right protocol, et cetera, that you're comfortable with or that your company lays out for you. So you do want to put yourself still out there a bit. You sort of can't just retreat to sort of showing up to the online meetings. You got to take advantage of hybrid opportunities to go be in person with people if you're still at the state of growing your own network. People tend to work with, promote, advance people that they know. So you really do want to, if you want to move forward in your career, you're going to want to get some buy-in champions along the way. No more example of this than in the venture space, guys. I saw many people that I know, they're not friends with them or I'm not in relationship with them, but I know of them. I saw venture deals left and right, people making like millions of dollars on health equity and health disparities sort of oriented companies. But I wasn't included, nor was anybody Black that I know included in any of them. So venture and IPOs were big. There were huge opportunities. But again, if you're not in those networks, if you're not a part of those, then you're not going to be included. So I want to encourage, folks as we move forward that, wow, if you're younger in your career and even at my point, I still want to build relationships with people. I'm going to need to be intentional now because so many things are online. So so we're thinking differently about that, but the core of it is the same. Relationships matter, people matter, and people really do want to work with people that they know and feel comfortable with. So
yeah, I think those relationships are Kathy, you mentioned ERGs and mentoring and coaching, and I lead a mentoring circle, and one of the extras says, I feel like Zoom meetings, this is your opportunity for your elevator pitch. How you introduce yourself should be a well-practiced thing, particularly for women, is some of the things I think about. But I think, Cheryl, what you're talking about in terms of networking, it needs to be more purposeful at this point. And you, the three of you, accomplished leaders and still generous with your time, sharing your wisdom today. Bobby, your thoughts about sort of
Yeah, I just wanted to jump on that. I mean, the word intentional has been used by all of us. And I think that really is the key, because current course and speed, if you just sort of go into the guide, none of this change is going to happen. Or none of it's not going to really get traction. One of the things that I've heard is said is that women are over-mentored and under-sponsored. So people are really anxious to tell women how they should be different and how they should act differently or that type of thing, but people don't take risks on them. And so I think for those of us who are in the opportunity, who have the opportunity to take a risk on a woman, take a risk on a person of color if you're going to take a risk, right? So don't just go into that easy glide path, because I think sometimes that risk, will have big rewards. And then for those people who are looking for it, being able to say very honestly, I know I don't have the depth of experience that potentially this opportunity, and maybe it's not even a new job, but this a stretch assignment or something. Maybe I don't have this, but I have some really good ideas on this, and I have a lot of energy, and I got a lot of fire in my belly to make this happen. And that women need to ask for people to take that risk.
That's great. I haven't been doing a good job here on my moderating. I see we've got some questions in the chat. So I'm just going to take some of those and encourage our audience to ask away with our incredible panel here. So back to the flexibility, which all of you commented on, is very important in terms of how to both accommodate, be empathetic to, but also get the work done at each of your organizations. The question is, how do you keep that flexibility and tolerance as we do shift back to the more in-person, a little bit less hybrid environments? Maybe Cheryl, your thoughts first.
No, I think the hybrid environment is really here to stay, and that employees will have, I think they'll have the choice to decide where they want to work. If an employer is not meeting your needs, people are going to leave and go other places. So I think many employers are thinking proactively about this new environment. Those are my thoughts. I know that's what I'm thinking. That's how I'm thinking about the workforce. I want to keep the workforce I have. I've got a great group of folks working, and so we're trying to make the environment such that they'll want to stay at Complete Care.
Yeah, maybe, Bobby, I'll take this next question to you as sort of another take similar type of issue. If your company says they're super flexible, but your female manager, and this audience attendee noted that specifically, is not as open to the flexibility, how do you navigate that?
So if this is the only thing that your female manager, maybe has a blind spot on, maybe you could, and depending on your relationship, you could take a shot at trying to educate your manager why this is so good to have this flexibility, how this is actually good for her as a leader, and how this is good for the company. But most of the time, when people are not kind of flexible about one thing, they're often not as open-minded about other things. And so sometimes you have to fire your manager, and you just have to say, life is short. Careers are built by being often in the right place at the right time with somebody who is willing to take a risk on you. And so to me, that's just a warning flag that maybe this isn't the best manager for you long term.
Mm-hmm.
I know that sounds harsh, but
tough advice. Yeah. That's tough advice. Have you ever done that? That's a big statement, Bobby. That's a tough one.
Oh, absolutely. There was a person that I worked for that was so toxic that my hair and my fingernails stopped growing. And I left without another job because I was like, I got to tell you, when your fingernails stop growing, you really got to think about that. And thankfully my husband was just like, I quit. We'll figure it out, so, but yes, sometimes you got to fire the boss.
Yeah, well, that is, again, in that sort of reevaluation as people are thinking about this. So navigate first before taking those, big measures. Those are big measures. Got another question. Maybe I'll throw this one to you, Kathy. So it says, do they still see women not supporting other women at the executive level? And how are you managing that? So maybe at the executive level that you are at, Kathy, how are other women supporting you or not supporting you? I mean, there's oftentimes talking about the higher up you go, where there's sort of fewer women around that table. It's not always, like you talked about, Bobby, and the Obama administration, of just sort of like, support for each other. Sometimes there's not support for each other. What do you do in that situation?
Yeah, I think women are human beings, and I mean we all have faults, and we all have great and we all have positive aspects to our personalities. So I mean, I think it's it's trying to engender trust. And so I have joined a group informally where it's mostly women. We meet like twice a month, talk through kind of challenges that the company, try and support each other. And so it's really trying to make that and socialize that idea that we need to support each other and that we need to bring each other up, and not and not push each other down and try and make yourself the focus, but really try and promote women internally and try and give them the resources they need, because we'll be stronger, we'll be better leaders, we'll be better human beings, and we will enjoy our work more if we support each other. And so it's making that normal and talking through it and making that unique presence, and really pull and really having that as a community. And so that's the way we've tried to approach it.
I think it's such good advice. It's just, it happens, right? At the executive level, it is not all support all the time from female colleagues, and that is natural, but the building of your network, as you all advised, so that you can maintain the confidence in yourself and your leadership, because it is important to have that as you go forward.
And I've had male colleagues be very supportive of women and trying to advance women. So we can't forget that. That's a huge part of your armamentarium, and pulling each other together, because lots of men get it too. And so it's really trying to, have a solid, forceful workforce that can get things done. And that's where it goes.
Great.
So could I just add, before this, we were talking about how as physicians, as women physicians, we often get called by our first name, where our male colleagues get called doctor. And in our organization, the way that this got a little bit resolved is that our male chief medical officer, who is just a phenomenal partner, just started calling all of the women doctor all the time. And it just like really just sort of fixed this problem and before it was brought to his attention, he didn't even notice. All the women noticed, but he didn't. And so now it's really gotten much better.
That's awesome.
That's great.
As
Very
we
cool.
close out here, just such a great conversation. I'd love to just close out with each of your thoughts on sort of, what does the year look like ahead, and your best advice for women who are aspiring to be leaders like you all are today. Maybe Cheryl, we'll start with you with your last best advice.
One, invest in yourself. Maybe this is a year to really begin to do that. Think about ways you invest in relationships around you. Relationships are very important with the people that you work with and people that you want to work with. So I would spend 2022 leveraging the hybrid environment, to improve, my position as a leader.
Fantastic. Kathy?
I think it's really focusing on reimagining both yourself, your workforce, your family. Don't keep static. What we've learned from the pandemic is that things just kind of got blown up. So let's make it better as we try to emerge, and we're going to have a new normal, and we should have the best new normal that we can. And it's your own creativity, personally and professionally, that'll get you there.
That's awesome. Bobby, what are your last thoughts?
Tell people what you want. Tell people what you're looking for. I think we as women tend to think that others can read our minds, and in a hybrid or remote work where you don't even have the water cooler things, if you want that opportunity, if you want to do something different, just be open about it.
This is just some great advice. And Megan, I really appreciate the opportunity to speak to these three amazing physician leaders, Dr. Bobby Byrne, Dr. Kathy Demuth, Dr. Rucker Whitaker. Really, thank you so much for sharing all your wisdom, being the leaders that you are. It's really inspiring to hear from each of you. Megan, I'm going to turn it back to you as we close out.
Thank you, Lori, for leading today's thoughtful discussion, and Drs. Bobby, Cheryl, and Kathy for sharing your time and expertise with us today. This was another yet inspiring conversation, and we really appreciate you taking the time out of your busy schedules to be with us here today. We have more events in this series, as well as some other great thought leadership events. So I encourage you to visit our website, www.hc3.health/events, to stay up to date. Just for a preview of this series, we have another community-based leadership discussion coming up in February. And our first in-person event since 2020 will be part of this series on International Women's Day in person, March 8th. So more to come on that. Additionally, today's session was recorded, so if you're inspired and you want to share or rewatch and take down furious notes as I was, you can find that on our website in the next few days as well. Thank you all again so much for sharing your time with us, and you have a wonderful day. And anybody in Chicago, please be safe and stay warm out there, okay? Thank you, everyone.
Thank you.
Bye-bye.